This video will discuss and explain GuidedTEMP, a very predictable product that guides temporary prosthetics into place using guided surgery. What you see imaged here is a traditional surgical guide that we prefer is for a fully guided kit rather than a partially guided kit, meaning the implant can be placed and controlled through the guide for very accurate placement. So this is a guide. This is a GuidedTEMP where you can see the provisionals are suspended over these sites using this type of guide that is supported. These are temporary cylinders. Different companies offer different types of temp cylinders or temporary abutments. We also send along plugs. You can see they're kind of clear here. Normally they're blue. And then gaskets that can be sleeved over the temporary cylinders to block out, and the plugs to place inside the holes of the temporary cylinders to block out to make sure nothing gets locked in. So there are, of course, normal traditional options for making immediate temporaries. Sometimes doctors float denture teeth into place. Sometimes they use digital technology to pre-make temporaries. But they have their challenges. It's very difficult to get the contacts perfect, the contacts correct pre-surgery. And you end up adjusting and adding to and modifying the restoration in the mouth to make it work, and that's a challenge. So instead, we came up with GuidedTEMP so that the hole in the temporary is pre-made according to the trajectory of the implant, the trajectory of the temporary abutment, and it is just simply suspended in space in the proper place to pick up and lute together to the parts. As you can see, it's a very advanced method of making a temporary. Even the emergence profile of the temporary is narrow so that it emerges from the temporary abutment, so that there should be very little pressure on the tissue in a flapless area, and so that there be very little adjustment needed subgintivally. So let's go through this particular case. Multiple implant site, immediate extraction. The patient is going to lose this bicuspid and going to lose the molar, and the doctor is going to place 3 implants using the surgical guide to both drill the sites and to place the implants. Now, some surgical guides only control the drills, and then the implants are free-handed. And in that case, there will be some adjustment on the GuidedTEMP, because the implant temporary cylinders will not be in the ideal place where they were planned. There is a method for using the GuidedTEMP in conjunction with placing the implants, but that's a little bit more technical and tricky. It's best just to use a fully guided kit. So this particular case, we're not going to go through the sequencing of the drilling or placing the implants. This is more about the GuidedTEMP portion. So as you can see here, this is pre-extraction. The teeth have been extracted. The guide is seated. Go through the normal protocols of drilling and placing the implants, and then add the temporary cylinders or whatever parts we recommended that you purchase or that we ordered and sent along with the case. Most cases that we complete are this package. So we will send the parts along with it. So go through that process, and then you place the implants, and the next step will be to seat the GuidedTEMP over the temporary cylinders or the cylinders. Now at this point there may be some adjustment on the inside of these to make sure that they're passive. You do not want any metal to be touching the walls of the temporary cylinder. But seat, right, and make sure that the supports are fully seated on the adjacent teeth, that the occlusion is correct on the GuidedTEMP. And forgive the shade on this. This is one of our earlier cases. We have a lot more shades now available for this type of material that we fabricate. So with this seated, you'll seat it, make sure it's passive, then remove it, and then you'll block out the cylinders to make sure you don't get any flowable down underneath to lock anything in, and then place the block out plugs in the temporary cylinders, and then just simply backfill with either composite or a light cured composite that's obviously a tooth shaded, or you can use like a stellar material. There's many materials out there that come in tooth shades. And just backfill and connect the tooth to the temporary cylinder. And once that is set, then you can complete some equilibration now, or you can remove the entire GuidedTEMP appliance, unscrew all three sites, take it back in the lab, add material to fill any voids underneath, and polish it, adjust it, bring it back to the mouth, and perform some equilibration until it's just right. In this case, a doctor used some tooth color material, and then backfill the implant holes with Fermit, or perhaps even just some PVS until the patient comes back, for a recall within a few days. And that is a GuidedTEMP multiple unit case. Photography was average or sub-average. Apologize for that, but you understand the flow, the workflow of this nice system for delivering immediate temporaries. This is GuidedTEMP. Thank you.